Bismillahirrahmanirrahim. Assalamu alaikum wa rahmatullahi wa barakatuh. How's everyone doing tonight? Good, good. Did everyone have a good dinner? Because we're planning to keep you here for a long time tonight. So I've asked the staff to lock the rooms. I'm joking. So again, welcome. Thank you for being here to our episode of Soulful Dialogue. We welcome you all. Inshallah, today's topic is an important topic that we wanted to share and discuss because we have a very prominent and a very great speaker who's an asset to the Muslim community just because of the background that she comes with. And that's in the field of crisis, in the landscape of crisis prevention. Crisis prevention is, it's huge in the community. Families most often might not be aware of how crises actually occur, or if they are in a state of crisis or somebody in the family is in a state of crisis, till something gets too late or till the situation kind of progresses and it becomes out of hand and things become more difficult. For that, inshallah, we've got with us Sister Sameeha Al-Kamal Jabbar with us. She is a licensed clinical social worker. She's worked with Orange County Healthcare Agency with the Crisis Assessment Team, which is also known as the CAT team, for the past 70 years, and has responded to mental health crisis calls here in Orange County as a Service Chief 1. She has worked at Kaiser Permanente Intensive Care Management. Currently is working at the Irvine Be Well. It's a psychiatric
Crisis response team.
Crisis response team here in Orange County, which was established pretty recently, about a couple of years ago. And I think Sister Sameeha will go ahead and talk more about that. And she specializes in trauma, grief, anxiety, and clients who are diagnosed with psychosis and bipolar disorder. So thank you so much for being here today and for accepting our invitation. Thank you.
Thank you. Thank you for having me. And can everyone hear me? Yeah, it is indeed a pleasure. And as Brother Wali mentioned, when you say crisis response, we think, oh, it's not going to happen in our home, or we are not going to know anyone who is going to be in a crisis situation. So mental health crisis is within our community. It's due to stigma and lack of awareness. No one talks about it. And when it comes to our families and our community, we try not to even engage when it comes to mental illness or mental health challenges. But being in this kind of field for the last 10 years, I've worked with the CAT team for 7 years. I have seen that over the years, the number of calls that we respond to Muslim families and communities have increased significantly. And this topic can be heavy. It can be like there's so much to talk about. Like, what are the triggers? What are the risk factors? What are the protective factors? What can we do to help the community? And I do feel very passionate about this because, unfortunately, when it comes to our Muslim community, we wait until the last moment to seek help. We unfortunately feel, yes, a protective factor is, you pray about it, you do zikr, you do ruqya, but at the same time, you have to also understand that a mental illness is an illness. It's a challenge. You need help. You need assistance. You need to start medication. You need to see a psychiatrist or a therapist, along with being spiritually involved. So what happens is, because of the stigma, you don't want to talk about it with anyone. And until it becomes a crisis at home, where you feel like someone in your family, or you may have thoughts of wanting to hurt yourself or thoughts of wanting to hurt someone else. It may be because of your mental illness, you might become aggressive, agitated, you might hurt someone, or because of your depression, now you are gravely disabled where you can't take care of yourself anymore or others. So it is a very important topic that I see many Muslim families and clients, and we respond to many calls. And is this good? Is this good? Okay. So please feel free to ask any questions. I will try my level best to provide whatever information and assistance I can. So please do feel free to ask any questions.
Wonderful, and thank you for that, Sister Sameeha. Inshallah, we'll leave the questions till the end. I've got some questions that I want to ask you first, and then we'll go ahead and open it to every one of you that's here, maybe the last 10, 15 minutes. So please write down your questions if you have any specific questions that you want to ask. And if it wasn't answered while me and Sister Sameeha are speaking, then please go ahead and ask her that question. I know you touched a little bit on this, but what happens when someone is in a state of crisis? Like, what are some of the signs and symptoms?
Yes. So when it comes to a mental health crisis, there are three components. That is, you become a danger to self, suicidal thoughts, or you plan or you have intentions, or you have your danger to others because of your mental illness or because of your symptoms. You become aggressive and you become impulsive, and as a result, you might become a danger to others or hurt others. Or you can be gravely disabled, where you have a severe mental illness, you're not taking care of yourself. Now you're depressed, you're in bed, you're unable to get out of bed, you can't eat, you can't sleep, you can't take care of yourself, and as a result, now you are gravely disabled, right? So the concerning part is, out of all three, I would say danger to others and being gravely disabled is something easy for us to assess or for us to notice. And when it comes to being danger to others, you will have someone who is very agitated, very aggressive due to their mental illness. They could be symptoms of schizophrenia or bipolar or anxiety, or they may suddenly feel like they are manic. They may be up at night, all night. They may feel like, okay, I can solve all the problems in the world. I can find a cure for cancer. You'll be like, what happened to them? Right? Or they would be like, I need to study, I need to study, and constantly they'll be up at night, and then they can be very irritable, they can be very aggressive, and you feel like you're afraid to talk to this family member anymore because now they're aggressive and agitated. And as a result, even if for the two, when there is a slightest trigger, they may attack someone or they may hurt someone. So now there is a crisis at home. You don't know what to do. And you try talking to them. So that is when it comes to danger to others. So I started on DTO first because the most important thing that I advocate the most is for suicidal ideation. Because you feel like, as Muslims in our community, being religious or being our connection to God and our faith actually is a very great protective factor. It helps us. It helps us. So when we do have suicidal thoughts, we know it's haram. We shouldn't talk about that, and that is not something that is allowed in Islam. So that does help and protect us. But unfortunately, a major psychiatric diagnosis like bipolar disorder or schizophrenia, when you have a disorder or mental illness, you can't see through that. You can't think about it. Your symptoms kind of take over, especially when you have hallucinations or when you start seeing things or when you start hearing things. You feel like you may think that God is talking to you, God is sending you messages. And in our community, sometimes we feel like, oh, they've been possessed by jinn, right? And they may feel like, I can solve all the problems. And they may become irritable. The mood swings can be intense that 1 minute they can be fine, they can be cleaning the house all night, or they can be happy and they'll be starting posting things on social media, and the next minute they feel like they can't get out of bed, and they feel like, why is this drop in mood? And then they may feel like, I can't go to school anymore. And a recent loss, divorce, grief, a major psychiatric diagnosis, they may feel like they're a burden to others. They may feel like they've gone through a financial loss and now they can't face the community. And they may start giving things out to others because they've already made a plan, like, I can't live anymore. So it can be a very impulsive decision, or it can be a decision where they've thought it out because their mental illness has taken over them. So it is a very, very serious risk factor, because out of the research has shown that 50% of those who completed suicide did not have a mental health diagnosis. So, which means that either no one noticed it or they didn't talk about it. So many a times the risk factors for DTS or SI is high, because especially in our community, you will not know about it unless you ask them that question. Do you have any thoughts of wanting to hurt yourself? And sometimes you feel asking the question can put the thought into their head. Like, we shouldn't talk about it. We shouldn't ask that question. So actually, 90% of the time, people have already thinking about it. But if you ask them that question, it allows them or gives them the opportunity to talk about it, and as a result get help.
Thank you. There's a lot of good information, but I wanted to now slowly kind of pick your brain on this as well. I know there's a lot of things you just shared with us. You know, a lot of diagnoses, right, with schizo, bipolar, um, manic attacks. When somebody has a manic attack, now in those, how does the family respond to a crisis? In your experience, how has that looked? Um, because I'm sure you know there's some of us here who have maybe a spouse, a child who go through crisis on a day-to-day basis, right? And a lot of us are not sure how to best, you know, respond to those crises. What would you suggest, and what has happened in your field of expertise, and what have you guys done so far?
It's there are lots of answers to that. First and foremost, when there is a mental health crisis at home, is this working? Is this working? Yeah. So when there is a crisis at home, a mental health challenge is not just a challenge that an individual faces, it's actually a challenge that the whole family faces. So it can be draining, it can be challenging for the whole family. And especially certain diagnoses like bipolar disorder, it takes time and at least a period of 1 year after you start medication for you to actually see that this person is back to normal again, or getting some kind of relief. So it's going to be where the family has to be very, very patient and supportive. So one of the most protective factors is social support. And it can be 1 minute they can be fine, and the next minute they can accuse family members of, you don't love me, you don't care about me, or why are you doing this?
And let me just kind of interject. That's really common amongst you know, someone that's going through a stage of crisis, especially those that are in a state of hallucination or delusion. They will constantly feel that you are literally like an enemy to them. So please be aware of that.
And many a times they would also, when they are in that state of crisis, or when they are manic, or when they are severely depressed, sometimes they may remember things that happened in the past. It could be trauma, it could be some family issue, or it could be certain sins that they committed. And now they are maybe paranoid or delusional, or they are extremely sad about what happened. So they may start talking about that. And at a time like that, if the family member expresses any thoughts of wanting to hurt themselves, what you need to do most importantly is not escalate them, not ignore them, not say, hey, just pray about it, right? Or just, go to sleep and you'll be fine tomorrow. The most important thing is asking them questions. What can I do to help you? And then if they start talking more, and if they express like, yes, these thoughts are nonstop, these thoughts are not going away, then the most important thing is to get immediate psychiatric help. Would you like to go see a psychiatrist? I think you need to go to the hospital right now. There are several hospitals over here in Orange County that do provide immediate psychiatric assistance. Any emergency room like UCI or Anaheim Global Hospital. We do have Mission Hospital, Laguna Beach, and one other hospital, St. Joseph's Hospital in Orange. They do provide emergency medical psychiatric assistance. And at the same time, if you need help or assistance, you can also call the CAT team. And you can call 714-517-6353. That's the number that you would call immediately. And then say you need someone to come home and to talk to them. And it's an approach because you are not trying to escalate them, but you're trying to give them that immediate assistance, especially if they have thoughts and a plan and intent. They may not tell you directly. They may tell a friend, or they may not say things like, I'm going to kill myself today. Or they may say like, I'm better off dead. Like there's no reason in living.
Now, should the community take it seriously, or family? Because I know I get families coming and they'll say, you know what, my kids or somebody in the family has a habit of just saying, I'm gonna kill myself, so we just brush it off. Now, should that be brushed off or not?
That's a good question. It depends on the context. Now, if you have a child who's saying that, And is this sudden? Why is what's going on? There's definitely an underlying trigger or an underlying mental health diagnosis that you don't know. When does that happen? Why do they say that? So you have to assess that. You have to ask those questions, and definitely asking them, do you want to talk to someone? Do you want to see a therapist? Right now, if this child is aggressive and agitated, they may have a diagnosis of ADHD. They may have issues in school, and they may be impulsive. They may have anger outbursts. And as a result, when you do have a child like that, trying to challenge them can escalate the situation. And they may do something without even thinking about it. And many a times you do have we've walked into a situation where it was a client in our community where, unfortunately, substance use is one trigger or a factor that actually makes a person engage in impulsive behaviors. So if they are depressed and now they're using substances on top of that, and they have some family issues going on, what can happen is they may escalate, and they may feel like they're agitated and aggressive, where they're fighting with family members, and they'll say like, I'm done, I can't live anymore. So when that happens, the most important thing is talk to them and ask for help, and take them to see someone, or to talk to someone, or call the numbers, or the CAT team, or even Be Well, but not escalating the situation and not telling them, hey, you should go back to bed, you should go out of the house, or you are being a disgrace to us, you don't understand what's going on. That will only escalate the situation.
In let's say in instances I've seen where families, it's very difficult for them within their hearts to seek help, especially call someone outside the house, right? Let alone go see a therapist. But it's even very difficult to even pick up the phone and call, the crisis team.
Mhm.
In those cases when that doesn't happen, um, is the child or the family in a state of bigger crisis, or is there any bigger challenges that kind of come from there if they don't seek proper help for that individual?
Yes, definitely. If they don't seek proper help, that is when they act on it. That is when they act, where some of them engage in self-harm. They might start cutting, or they may not leave their rooms, or they may actually plan and actually complete a suicide attempt. And you may think, you know what, why would they do something like that? In our religion or in our community, that's something that shouldn't have happened, right? But you have to understand that it's the mental illness that takes over. So they can't comprehend, they are not thinking through. They feel the pain, the mental pain is so severe that they feel like they can't live anymore, and because nobody understands them. So many a times I had a situation where one of the clients I met said, this was a client who was actually wanting to jump off a freeway. And he said, why are you talking to me? Nobody has helped me. Nobody can ever help me. Like, I'm going to do it anyway because my life is miserable. Like, I have no connections with my family. Everyone let me, everyone let me down. Right. And it was, at the right time, we had to go in, talk to him and say, give us a chance. Like, let's talk about it. Give us a chance. So, and then 2 weeks later, they were like, I really didn't know that there was help. I really didn't know that people could actually understand me, because no one asked me, how can I help you? No one asked me, instead of what is wrong with you, no one asked me what happened to you. Because that's one thing that happens, is that unfortunately, when you see someone, especially a family member or someone go through a crisis or sudden change in their behaviors, you'll be like, what's wrong with you? Unconsciously, we say, what's wrong with you? But we don't take a few minutes to ask, what happened to you? And sometimes all they want is that validation. All they want is someone to listen to them. And then they will like, yes, you know what? I think I need help.
Yeah, no, very. Does it work? Can you guys hear me? I like the other mic better. Thank you. So yeah, so thank you so much for sharing that. Just to piggyback on that, it's so important when we mention active listening and asking an individual, how are you doing? I think we're always in a state of always finding solutions and finding solutions for others, but not realizing that somebody maybe within our family is not looking for solutions. They're just wanting to be heard, right? Because there's a lot of things that go in an individual's mind, especially when they go in a state of crisis. It's the mind is really scattered, because it's not that you're going through, an issue or a difficulty. There's multiple things that kind of come about, and then eventually the mind just takes over, even the frontal cortex of critical thinking. Now, when that happens, like Sister Sameeha beautifully stated, is asked a question. And we also have to remember that we live in a society where, where it's very fast paced. We don't get time to really sit with an individual and literally ask them about how are they doing, how are they feeling. Just recently, I'll give you a story of a dear friend of mine, which I didn't realize. May Allah make it easy on him, but he's going through some difficulties and challenges. Who I personally, I grew up with him since we were in middle school, so we've known each other. But then throughout over the years, when we graduated from college, I got married, he got married. We have families. You get busy in life, and the bigger picture of life, and then with your own families. But we had a mutual buddy who came out of town, and luckily we both met. And while we were speaking, I found out that he is going through, immense crisis, um, and he never brought it up to me. And I was honestly I was very hurt, because I was like, brother, I've known you for so long. I work in this field, and I had to call him because through our mutual friend, when he told me what happened, the next day we sat together. I said, "Hey, let's call him because I want to know what's going on with him, because I feel bad. Like he's a good buddy of mine, and just like you should at least take the time to ask what's going on, right? At least show some care." And his response was, he comes from a good place. He was like, "I just didn't want to bug you, and I know how busy you are." And I was like, "You got to throw that away. Like, you really got to throw that away. You know, when something like this happened, please don't look at me in any other way, just as, being somebody being there for you as a friend." And that's something that I'll constantly tell myself, is that living in a society that's very fast paced, also coming across families who actually don't take the time to ask their loved ones, "Hey, how is your day? How are you doing?" Not, what did you do, what you didn't do, but how are you doing? Just literally just asking them, sitting next to them, holding their hand, "Are you okay?" Right? It's very important. So please, if you guys can, practice that a little, and create that initiative amongst your family and your friends and community members, inshallah, that would be very beneficial for all of us. I would love to have someone come to me and ask me, how am I doing? Sometimes I might just get started and say, "Well, you know what, I'm a little stressful." In those moments, just be there as an active listener. No solution is needed. I wouldn't want you to give me an answer or reply. I just need to talk to somebody. That's all. Simple as that. But coming back to Sister Sameeha, I wanted to ask, when it comes to, I know you mentioned this earlier. You can take your loved ones to the hospital. These are like a voluntary hospitalization. How does non-voluntary hospitalization look? And when the PERT team comes, or the CAT team comes, how can we encourage the community to call for services if they feel like, what, this is too much, I can't do it anymore, it's starting to affect my health, the health of my loved ones in the house. Just, how can they actually take the step, and what does that step look like with the CAT team?
That's a good question. If you feel like at this point I'm not safe, as Brother Wali mentioned, I'm not safe, or my family member or friend is not safe, and I feel they're going to do something to hurt themselves or others, immediately the most important thing is you don't tell them that you're going to call the CAT team. You don't tell them that you're going to ask for help, because they might get escalated. They might not want help, right? Because if you, already you would have probably asked them, "Let's go to the doctors." Like, "No, I don't want to. I'm fine."
right? Or they don't want to talk about it. So you call the numbers and you let them know. And what they do is usually a licensed clinician, a CAT team clinician would come down to your house, and they will not look. They sometimes they might come with a police officer if the family member is aggressive. If not, they would come in and they would talk to them. They won't arrest the person. It's not an arrest. That's what. And one thing you always have to know is that we are all, as clinicians, bound by HIPAA law. So there's confidentiality. We cannot provide any information of talking to a client or taking them to a hospital or placing them on a hold on an involuntary hospitalization. This information is not even shared to family members if the release of information is not signed. So the client decides who this information has to be shared to. So when you call the CAT team, they come in, they talk to them, and if they would offer voluntary hospitalization. Hey, you need to go to the hospital, would you like to go with us? And if they say no, I'm fine, but if the risk factors are high, then they decide at that moment to place them on a 5150 hold, which is called an involuntary hospitalization. So they can be, in other words, forced to go to the hospital. And when they go into the hospital, immediately the psychiatrist would see them. If they need medication, they would start them on medication. A 5150 hold is for 3 days, and they would be in the hospital for probably 3 days to help them with the medication, the monitoring. And if the symptoms still persist, if they are still showing symptoms of psychosis, or if they're still actively suicidal or wanting to hurt someone else, then they can be placed on an additional 14-day hold, which is called a 5250. So this may seem like it's too much. Like, why? How I would say, what I would tell family members or a community is, if you get ill with the flu or something happens, you go to the hospital, you stay there for a week or two, so you come back home and you feel better. So it's the same thing. You're mentally ill doesn't mean that, oh, this guy is crazy, or you don't have to tell anyone about it. That's a stigma. So you stay in a hospital for a week or two so you can come back home and you can be with your family and your friends, and you can get back to your normal routine again. So that the stigma is something that we have to address repeatedly and make it and normalize this. Getting help is something that we have to talk about, because unfortunately the stigma has affected our community, and throughout the years I see the numbers increasing, and I have seen the number of calls that come in, and unfortunately when they call, it's like the worst stage. They could have asked help before. They could have prevented a crisis.
And I was going to ask, so Sameeha, what is the preventative measures that a family member can take before it gets to this level of crisis? What can be done at that?
That's a good question. I think I'll piggyback on what you said before. As a community, we all come from communities from other countries where we had a village to support us. And we had people coming in and out of our homes. We had people to talk to. But when we are in this society, unfortunately, if you don't have the family and the friends and the support, you're isolated. You feel lonely. You feel like there's no one to talk to or support you. And one important risk factor is, apart from major mental health diagnosis or psychiatric diagnosis, is postpartum depression in women. So one of the most common risk factors is postpartum depression, and one of the symptoms is suicidal thoughts at that point, because the hormonal imbalance is so bad that at that point you don't know what's happening to you. You feel like nothing's helping. You can't connect with your baby. You're depressed, you're crying, and at that point you have suicidal thoughts. But what happens is, over here you're alone. You don't have that village to come and check in on you. And as Brother Wali mentioned, during those times, like checking in on, like, how are you doing, what do you need, let's go out somewhere, right? That really helps. That can prevent a crisis, and that will open up an opportunity for them to talk to about what's going on. And when you see someone, like, especially some of the signs that you have to observe is, if you see that the behavior of your family member or your friend has suddenly changed. Now they're isolating themselves. Now they're withdrawing. They're not going to school. This person who was a happy person or who was very friendly is now irritable, now angry, or you feel like they are manic. They're up all night. They are focused on school. They may do really good. They may be very productive, but they haven't slept for days. That is a huge factor. Like, if I don't sleep for 2 days, I'm done. The third day, I lose it. So if someone hasn't slept for 3 or 4 days and they are constantly working on something, that means they're on a manic phase at that point. So that is something to notice, that you have to understand. They may say that I'm solving, I'm working on school, or I'm trying to find a cure for cancer, or I'm working on this AI project, because they get very involved. And those are some of the symptoms and signs. And if you feel like now they're becoming aggressive, or they're depressed, they're not eating as usual, they've lost weight, or they're not talking, they're not engaging in previous pleasurable activities. You see them going to the gym before, you see them going out with friends, now they are not. Those are some of the signs that you notice, and you address it. This can prevent it from escalating, and this can prevent from it becoming a crisis.
Thank you. And just like Sister Sameeha said, you're the first point of contact to your loved ones. And then secondly, when and this is normal. Like, we're not specialized in many things, right? And if you need outside help, please reach out to your local therapist or clinician, or somebody that can help provide support. A place where they can go on their own, or you can take your family or your loved one to, and you can ease their pain or the struggles that they may have. Because if you don't, it's like it's like a soda bottle. You keep shaking it and it'll eventually explode, right? And that's what happens with the human mind as well. It can go so far where the mind just kind of gives out, and then you go in a state of psychosis, and the mind will take you to will take you to doing different things, and those things lead to harming others, or even attempting suicide. So the mind is very powerful, but as much as we think we have control over it, we do not. We do not have control over it. Um, Now, thank you so much for all that helpful information. Inshallah, what I'm going to do is I'm going to go ahead and open the floor for questions. So if you have questions, please raise your hand. So you have the next 10 minutes. So please, we'll keep it to questions only. Yes, sister, go ahead. Yeah, thank you for that question. So I'll repeat the question for our viewers online. The sister asked, what would happen if you were calling your son's or your daughter's doctor about getting information, or telling them about symptoms? These are the symptoms that are occurring, but the doctor will go ahead and not disclose any information because they're over the age of 18. So what do you do when you're in that situation as a parent?
That's a good question. And that's one of our challenges as well, because I mentioned confidentiality before, right? Now, as a clinician, we can take information. Now, if we know that you're a family member and you're calling, and if you are giving us information like, hey, this happened the other day, I just want to give you this information. And however, we cannot provide information without a release of information. Does that make sense to you? Like, we can if you are giving any additional collateral information, it's called collateral information. He said he wants to hurt himself yesterday, or she said she doesn't feel good. That information actually helps the psychiatrist or the therapist. Now, during a crisis situation, though, the right thing to do at that moment, if you feel like the family member is not safe, instead of calling the psychiatrist or waiting for a day or two to get help, immediately calling the CAT team or even calling the police department, they will send the CAT team out, because that is helping them immediately. But trying to talk to the psychiatrist after 2, 3 days can be a little too late. So when it comes to a crisis situation, you either call the CAT team, or you can also call the Be Well team. There are, if you have seen the blue vans, they call Be Well in actually 7 cities in Orange County. So Irvine, Anaheim, Laguna Beach, Newport Beach, Westminster, Garden Grove, and UCI and Huntington Beach actually have those Be Well teams. So if you live in one of those cities, you can call the police department's non-emergency number and say, hey, we want the Be Well team to come and talk to someone.
They can come home. They don't come with police. It's very discreet. It's confidential. They will come. They'll talk to them, and if they feel this person needs to go to the hospital, they might transport them, or they might even call the CAT team if they need to be placed on a involuntary hold. So calling the doctor at a time when you feel like it's a crisis at that point, yes, it can help. Even your psychiatrist can ask the CAT team to come home. But if it is an imminent crisis situation, it's best to call these numbers that I mentioned. Did I answer your question?
Yeah, that's that's the law. That's the thing. So you can't really do much because it's the law. All in America, once you hit 18 and over, you have the right to your privacy. So it's going to be very difficult to go around that unless somehow you can be involved in your child's care earlier on, and then they allow you to have that access, right? If they don't, then by all means it is challenging, but it's once they become 18 and over, it's just unfortunate, but we can't really do anything. So this is where Sister Sameeha has said, if they're in a state of crisis and you feel like this, my kid needs help, then you go ahead and initiate, like you call the CAT team, or you seek for help. So you will always get professionals that will come out to you and assess the child, and your kid and your young adult. But if the kiddo is, has certain symptoms, but you can have symptoms, but you might not be you might not fall into the category of a diagnosis, and that's okay. Like there might be days where I might get up and I don't want to get up and do anything. I'm like, I don't have energy. Excuse me. I feel depressed. And it lasts for a week or two. My parents might not be happy with me or the way or what I'm doing for those 2 weeks, but that doesn't qualify me for having any form of diagnosis. It might be something where my behaviors might not be appropriate or pleased, or my parents might be concerned for me at that moment, but I might not qualify to have a diagnosis in those scenarios. That's all. Yeah. Her question was, what do you do when you have a young adult like over the age of 18, and your child is over the age of 18, and you want to talk to their primary care doctor, and they say, well, because of HIPAA compliancy and not having the authorization or release by your young adult kiddo to be able to talk to the primary. That's all. That that's what we said. Yeah, no, thank you. No, we said that. Yeah, and it's again, it's a legality piece. It's very difficult to go around it. There's ways to go around it, but you, yeah, yeah. What I'll do is we'll have that discussions afterwards. Let me just get more questions because we're running out of time. But afterwards, when we're done, we'll come back if you guys want to come and ask more questions. And I think that's good information that you're sharing as well. I think it's much needed. Anybody else? Any questions for now? Yes. So the question was, where do you seek help when you don't have insurance or are uninsured? And in Orange County, where do you seek help? Where do you go?
Yeah, that's a good question. So in Orange County, for mental health assistance, the Orange County Healthcare Agency, they have several locations. Like I mentioned, all over Orange County, they have several locations. You can walk in, or you can call them and ask for an intake appointment. Now, if you are uninsured, what they do is, after when you go
into the clinic for your first appointment, they will actually get you enrolled in Medi-Cal, or they would provide you services on a sliding scale. Now, if you call CAT team, they don't ask you what insurance do you have. They will come out, they'll provide that assistance, they'll help you. If you have insurance, then later on, the insurance would cover it. But if you're uninsured, you will still get the assistance and the help you need.
So you're asking primarily like what kind of like certain organizations don't are probably not. Are you saying when organizations are rendering providers for like a Medi-Cal recipient? Crescent, certain organizations. The only thing is that so I think some of those organizations, they do their best to provide free services unless they are filled with slots. But at that point, what happens is that those organizations are at the moment not registered with the state to be a rendering provider to accept Medi-Cal or any insurances. That's what's happening. Yeah, that's what it is.
Therapy, though, certain organizations like the Rahma Center in Lake Forest, ICNA as well, they do provide free therapy for a certain number of sessions. So if you are unable to, if you're unfunded or if you have no insurance, you can reach out to those organizations and they provide 8 to 12 sessions of free therapy if you need assistance. So those are a few organizations in Orange County that provide free therapy.
Yeah, I was gonna say Khalil Center, ICNA Relief, Rahma Center. Our organization, Qazizada Multicultural Therapy Clinic, does they provide a couple of free sessions. Access California Services, yes, thank you. So there's organizations out there that can provide you services. Now it looks different, long term. If you're there, usually therapy services are provided short term. So long term would look a lot different. Yeah, a lot of these organizations wouldn't be able to keep you for like long term, like a year or two. It's just short term. They can provide short term services anywhere between 8 to 12 sessions per whatever what goals you set forward, and they'll just help you in that case scenario. Now we can take maybe one more questions before we conclude, inshallah, because it is close to Isha prayers. Any other questions? We will go ahead, Sister Sameeha, if you can share that number again, and then what we can do is we can always put it in our ticker in social media, and then we'll come to your question, brother. So, based on our observations, what are some of the mental health challenges that we're seeing in the community, or the most common challenges, and what are the reasonings for it?
So, causes for mental illness. So that is a question I wish we all had answers, right? Some of it is predisposing factors, like it can be a genetic. You can have a family member who has a diagnosis of bipolar disorder or schizophrenia or depression. That's a question we always ask. Do you have any family members? So there can be a genetic component. And then you have environmental factors, societal factors. It could be where you have this sudden loss or grief, and or you have a financial loss, or you feel like there's a divorce, or nowadays there's so much trauma that we see day in and day out, and that could be very stressful. Now if you already have a genetic predisposition, and at the same time now you go through this immense amount of stress, that can immediately trigger for you to have a breakdown, or for you to have symptoms of severe mental illness, right? And for example, I had a client who was doing absolutely great, going to school, was perfect straight A student, right? She did have a predisposition, or she did have a family member or history of bipolar disorder in the family. So, of course, after going to college, after 2, 3 years, now the stress was immense, and also had relationship issues, family issues that triggered her to have a breakdown and an episode of bipolar disorder. As a result, she was hearing voices, she was delusional, and walked into traffic wanting to end her life. So those are some of the triggers, but unfortunately you can't say that this causes the mental illness. So these are all factors that contribute.
Thank you for beautifully explaining that. And what I will do is, and maybe in the next program, or I'll have it shared. But in the first program that we had for Soulful Dialogue, I had also had a chart that kind of explains that reasoning in factors that can contribute to mental health illness. So maybe we can reshare that again or explain that again. But again, thank you so much. We want to thank you for being here today and giving us your time. Any last thing that you would like to share with the community? And then, yeah, and we're done.
What I would say is be compassionate. And if you feel that someone is going through a challenging time, or they are challenging to be with, or they are now talking about what they're going on again and again, instead of saying get over it, or instead of saying go pray about it, ask them questions, be there to support them and help them, because you may be saving their life. They may not tell you what's going on. Just checking in on them, talking to them, may actually help them. That's probably one thing they needed that day to make a decision to go ask for help. So make sure that you're not making any comments which could be judgmental or not hurt them even more. So ask questions, show compassion and kindness. I think that is what really helps our community, because we do have a very strong community and we need to make sure that we support each other.
And also, yeah, the number real quick.
CAT team number?
Yeah.
Yeah. The crisis assessment team number, I know it by heart. It's 714-517-6353.
Thank you so much, Sister Sameeha. Again, thank you for being here. And then for those, I know it's important to ask, reach out for help for your loved one, but also remember, if you feel like, something is off and you're not feeling well, something in your guts tells you that, well, even my loved ones or family members are telling me that, I'm becoming short fused, I'm getting irritable, also be open to seeking services and help for yourself as well. Again, thank you so much for giving us your time, and everyone that's here. May Allah subhanahu wa ta'ala bless you all. Have a great rest of your night. Jazakallahu khairan. Wassalamu alaikum wa rahmatullahi wa barakatuh.